Does your daily caffeine boost do you more harm than good? Well, in this video, I'll aim to discuss how caffeine works. Are there any benefits to caffeine use? Are there any drawbacks to caffeine use? And what is the recommended usage to maintain safe practices? So let's start with how caffeine works. So it works to block a chemical that builds up within the body every single day after you've just woken up. That chemical is called adenosine. And the way it does this is that caffeine mimics that structure of adenosine. But the difference is that when it binds to the site of where adenosine works, it doesn't activate it. So adenosine builds up slowly throughout the day and it will make you feel more tired. It slows you down cognitively and also in other functions such as your heartbeat, etc. So caffeine, by blocking them actions, will increase heart rate. It will also increase this feeling of alertness and energy levels. So that's where we get the boost from, and that's where the saying comes from that you can't function without a morning cup of coffee. One thing to not forget is that caffeine is actually a drug, because a drug is anything that alters the normal function of the body. And US adults are estimated that 90% of them are using caffeine on a daily basis. So this is a drug that's in common use, and it's celebrated if you look at coffee shops, tea shops, wherever the culture, caffeine is used. But with all drugs and medication, there are benefits, but there are also risks and side effects, and you need to balance them up to see whether caffeine is perfect for you or whether you should remove it from your lifestyle. Now, a few things to note before we go also into further mechanics of caffeine is that caffeine has a half-life of 5 hours. So what does that mean? So if you've got 100% levels of caffeine in your blood, after 5 hours, they go down to 50%. After a further 5 hours, it goes down to 25%. So this is important when you are thinking about how caffeine affects other areas of your life. If you have a higher dose, it is going to take longer to clear it fully from the body, and you will have residual levels later on in the day, despite taking it earlier on. Now, for disclosure, I actually do have caffeine on a daily basis. I have 2 to 3 cups of double espresso coffee, which amounts to about 360 milligrams a day. I will put up a table regarding the common values of caffeine that are in a lot of products and supplements, because caffeine is rarely used in its isolated form as a caffeine pill. It's normally consumed in coffee, like I've just said, about 60 milligrams per single espresso shot. You've got it in green teas, black teas, you have it in some chocolates and confectionery, and a lot of energy drinks obviously have caffeine because that's how they are marketed. But also pre-workouts, which has been more prevalent within the market over the last 2 to 3 years. The only difference with this, and I will come on to it later, is that pre-workout has large doses of caffeine, which I necessarily don't agree with, and I would take a lot of caution when coming to pre-workout use. And whilst we're still on the science of caffeine and caffeine breakdown, for example, there are certain user groups that will experience different metabolism of caffeine. So like I've just said before, on average, it takes 5 hours to remove 50% of caffeine within your blood. There are certain people, such as tobacco smokers, where their rate of clearance is increased by 60 to 70%. So in these group of individuals, they will feel the effects of caffeine far less than the average person. When on the opposite end of the spectrum, someone who is pregnant and dependent on which trimester they're in, they can have up to 65% reduced clearance. So you can see it can be a swing of 120 to 135%, depending on which cohort you fall within. So these are all important factors to determine whether caffeine is safe for you to use and at what dose you should be using them. Now, I will go into the benefits, but one thing I will note is that the benefits of caffeine are normally seen within the range of up to 300 milligrams, maybe 400 milligrams a day. After that point, you will see a lot of side effects and adverse outcomes, which I will come on to later on. But this is just a rule of thumb. 300 to 400 milligrams a day is normally a sweet spot, and that's where I sort of navigate within. Like I said, 360 milligrams a day is probably where I sit on a daily basis. So in the short term, caffeine, because it increases alertness, you will assume that it has the benefit of improving cognitive function and skilled tasks. So this effect can be seen as little as 60 milligrams a day, and a lot of people will have greater focus, and it's used a lot within this environment. And to go alongside that, you can also correlate that with sport and performance. So if you take caffeine before doing a workout or an endurance activity, you will see a greater output. And even though this exists, it's still not a banned substance in normal dosages when it comes to the International Olympic Committee. But sadly, the more I've looked into caffeine, it's actually quite hard to ascertain what is good, what is bad, and whether the evidence is actually strong enough to advise on certain things. So there is something with a lot of studies called observational or cohort studies. So that is where they observe a population in retrospect, and they haven't necessarily set out to look at one specific factor at that one point. So you can't really draw this ability to say this caused that. You can only say this is associated with this. And that's a lot of caffeine studies. And also there is something that exists within these sets of cohorts is this healthy user bias. And what I mean by that is, if you look at a study of vegans, for example, they are normally consciously making this decision to go down this vegan diet. And a lot of these people are health conscious in other areas, so they tend to go to the gym more. They are more aware of what is coming in and out of their body, so you will get very good results. But is that due to the vegan diet, or is it due to the fact that they are more health conscious and do other things that are beneficial for their health? And this also exists for caffeine, but caffeine is slightly different. So if you think about caffeine, you can have someone who is using large doses daily before a workout or physical activity. Everything else in their life could be really good, and it could be due to the fact of multiple things within their lifestyle. You've got other people on the other end of the scale who are using caffeine because they've had poor sleep or they've got a lot of stresses in their life. So they may be making more poor health decisions related to diet, exercise, etc. So the health bias is pretty uncertain in caffeine studies because there is such a wide spectrum of where you could fit on this graph. But going back to benefits, we've got cognitive improvement and increased skills, function and tasks. We've got increased sport and performance. And when we come to cardiovascular disease, so this is anything related to the heart and vasculature, it's mixed again, but in some instances it has improved the recovery from irregular heartbeats, and then in others it hasn't. So this is something that I'm not going to say is a benefit, but I would mainly go down the fact of its ergogenic effects, which is sport and performance and skill tasks. That is definitely a bonus for caffeine. Now let's go to the negatives, which I feel as though at the moment I will probably focus more on these because I think a lot of people misuse caffeine and forget that it is actually a drug and it can actually negatively impact your life going forward. So if you are pregnant, I would strongly advise anyone to not have caffeine because the studies are showing that for every 100 milligram increase in caffeine throughout a pregnancy, it leads to a 26% increase in pregnancy loss. And then a lot of studies were shown where they actually not only look at pregnancy loss, but also look at the developmental progress in the offspring and found out that a lot of them have childhood obesity and decreased cognitive function. I would strongly advise abstaining from caffeine during pregnancy because these effects we're seeing from as little as 100 milligrams a day. When it comes to other adverse effects, so caffeine can increase your heart rate. And like I said before, the evidence in cardiovascular disease and heart conditions is not conclusive. So what I would say is if you have a history of any palpitations or heart disease, I would preferably stay on the lower end of caffeine, or if you can, remove it altogether because that evidence isn't concrete enough to make a really well-informed decision on that. But going back to its effects on heart rate, it can increase heart rate by literally reducing the adenosine activity within the heart, which will lead to increased heart rate and palpitations. By doing so, anyone who is more predisposed to anxiety symptoms, you will feel greater anxiety and anxiogenic effects when you are taking caffeine because it is doing everything that the body would normally elicit as a response to stress and anxiety. And these effects are normally seen about 400 milligrams plus a day. Again, if it's not doing any good for you, try and remove it from your life. But there's no harm with coming away from it in terms of a cold turkey approach where you stop it abruptly. But with anything, I would always try and taper down gradually because then you've got a greater chance of removing it from your lifestyle and you've got a greater chance of reducing the impact of side effects going forward. Now, arguably the biggest negative impact of caffeine is on your sleep. And there's a lot of studies which show that the time it takes to get to sleep is increased by 45 minutes, which obviously isn't ideal in a lot of people, especially if your schedule is very restricted, so you need to get to sleep as soon as possible. The evidence then is that it reduces your time in deep sleep within the first 3 hours by about 28 minutes. Again, not ideal. And it can also reduce your overall duration of sleep by 2 hours, which in comparison to the decaffeinated control group was 25% less time in sleep. And this is where I feel caffeine needs to be assessed, is the impact on your sleep, because then if you have poor sleep, you go into the next day by consuming arguably more caffeine because it gives you that alertness, the energy that you feel when if you were to be fully rested, for example, but we know how caffeine works, and then you go into the next night, you can also create more sleep debt, and then you are going to make more consequential decisions in relation to your health. Maybe not exercise because you don't feel up to it, make poor dietary decisions, and then it keeps going on and on and on. You'll get increased stress responses, anxiety. So this is where, if I was considering whether caffeine, apart from pregnancy, was to be included in my daily routine, I would look at the impact on my sleep. Now for me, I am classed as one of the cohorts who metabolize caffeine very well and very quickly. So it is late now when I'm recording this video, it's about 9:30. I could potentially have caffeine right now and it wouldn't really affect my sleep. And there's something that I actually didn't mention earlier on, is that a lot of people who are taking a lot of antidepressants at this moment in time, normally to a group called SSRIs, which are selective serotonin reuptake inhibitors, such as sertraline, fluoxetine, they are more predisposed to the effects of caffeine because it reduces their metabolism by 30%. And one thing that was interesting to me was that the combined oral contraceptive pill, which contains estrogen and progesterone, they also decrease the metabolism of caffeine, mainly due to progesterone within that tablet. But this also corresponds to the luteal phase of a woman's menstrual cycle, which is the last 2 weeks. So I was asking my wife whether she was affected, and in the last 2 weeks of her cycle, she seems more affected by caffeine. So that can be palpitations, headaches, etc. So the advice that we have there is she has a morning coffee, but after that morning cup of coffee, she then leaves it or has a decaffeinated coffee later on in the day. It gives greater time to metabolize the caffeine so that when she's going to sleep, there is less of it within her system to affect her negatively going forward into the next day. For some reason, making this video was actually quite difficult. I don't know why. I know a lot about caffeine. I've looked into it a lot. I just feel as though recording it today, I just put a lot more pressure on the situation to try and make the video better. But as a general overview, caffeine is a widely used drug. 90% of US adults use it. I personally use it. I know a lot of people that don't. From a workout point of view, I've never used it because I always think if I am not mentally ready to go and do a workout, then I feel as though I am at an increased risk of injury. So I don't do that for that reason. But those who do use pre-workout, for example, they are in whopping doses. Some of them can be 300 milligrams, which in my opinion, to have one 300 milligram dose of caffeine, normally supplemented with coffees throughout the day or teas, you are just putting your heart under unnecessary pressure. And with the limited evidence that we do have, I feel as though it would be wise or prudent to stay away from high doses of caffeine. So I would personally advise that. When it comes to the negative effects, like I said, normally over 400 milligrams a day, you will see these negative effects. If you are predisposed to anxiety, it's probably not a good thing for you. If you are greatly affected by caffeine in the sense that it impairs your sleep, then I would completely remove it again. Or if you are pregnant, I would advise to completely abstain from it for the totality of pregnancy. The evidence in terms of how long before you should abstain from caffeine is limited, but again, with any medication or drug, 5 half-lives is when the drug is fully removed from your body. So in the sense of caffeine, 25 hours should technically 99% of that metabolite or the drug should be removed from the body. So that's a good rule of thumb. Try and do 2 weeks before conception. I don't know, the evidence isn't there yet. And I also feel that doing a live stream actually better suits me. I haven't scripted this video, but I feel as though when I try and do it in a sense where I'm trying to be more concise and having less gaps between what I'm saying and trying to make sure I relate to certain stats that I wouldn't have probably included otherwise, then it just makes the video not flow as well. So I don't know whether live streams are probably better for me going forward. But I always forget this part, is that the disclaimer is that it is not medical advice. We have not had a relationship with a healthcare professional and patient, and you should always seek advice from your medical provider. And if you have got this far, thanks for watching. Any suggestions, pop them below and I will see you and I will see you in the next one.